Day, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today I'm with Dr Stacey and we're talking about fibroids. So hi, welcome back to my channel. Like I said, today we're talking about fibroids, and with me I have Dr Stacey Gynaecologist, who is an obstetrics and gynaecology doctor. In the UK we call them registrars, which is one of the senior doctors, and she's here today to help us understand a bit more about some of the really common gynaecological conditions. This is actually the first of a two-part series where we're talking about the two most common gynae problems or women's health problems, and that's fibroids and endometriosis.
Yeah.
Thank you so much for joining me today.
Thanks for having me.
Yeah, I thought it was really important to get you on because so many of my followers, they've been asking questions about lots of women's health questions.
Mm-hmm.
And although in GP I can answer a lot of questions, the things that I get asked a lot about are fibroids and endometriosis. And to be quite honest, in GP, we do some of the work, but really the portion of it is so small.
Yeah.
And so there's only a certain amount I can advise, and so I'm really glad that you've come here today.
Oh, lovely.
So what I'm going to do is I'm going to give a background about what fibroids are. And then on my social media and on also Dr Stacey on her Instagram as well, we put up a story, a question sticker asking for your questions about fibroids and endometriosis, and we got quite a few questions actually.
Yes, you did, yeah.
So we're going to go through those questions, so I want to answer those for you, but I'm just going to give a little brief background beforehand. If you're not following both of us already, we're on Instagram. You're
at caramel_doctor7.
Yeah, and I have it just under here for you, and I'm live with Dr Amanda, and so be sure to follow us because Dr Stacey, she gives so many amazing health tips.
Oh, thank
Her
you.
content is wonderful. She's been in the game longer than I have and she's doing a great job as well. And I try and give some tidbits as well, so please follow us over there. But let's get into it. So as I said before, fibroids are extremely common. They're actually the number one gynecological problem that women face. They are the most common non-cancerous tumour out there for women, with 77% of women at childbearing age suffering from fibroids, and so it's a really important topic that we speak about. So these tumours, they're usually quite slow growing, and they're usually stimulated by the female hormones, estrogen and progesterone, and so they grow quite slowly over many years, but usually around menopause they start to shrink and become less of a problem. Is that right? And it's difficult sometimes to know somebody does have a fibroid because not everybody has symptoms. Often what I see in general practice is that a lot of people have this incidental finding of a fibroid. They have an ultrasound scan for a variety of reasons and we see that there's a fibroid there. And I think it's about 50% of women actually don't have many symptoms at all.
Yeah, that's right.
Yeah, but there are a big proportion of people that do have symptoms that can be quite debilitating to them. And actually, I know one of the questions we were asked about the risks of having fibroids, who's at more increased risk. And from what I've seen, I think it does seem to happen a lot more in people who are obese.
Yeah.
Also people that have not had many children because they've had more estrogen in their system for longer. Also people that have started their periods quite early on as well, just because the amount of time estrogen has been circulating in the body is longer. But another group of women that are really affected, and this is one of the big questions we got about, were black women. And black women are 3 times more likely to have fibroids. They are more likely to have bigger fibroids, have them at a younger age. They're more likely to have more numerous fibroids and more symptoms as well. And so it really does affect black women quite heavily, these fibroids too. And usually in their 30s or 40s where women start to experience symptoms from their fibroids. And symptoms can vary, but what I've seen in general practice is more heavy bleeding. So people have these heavy prolonged periods that can sometimes make them anemic. And then also, the size of the fibroid can cause symptoms too. If there's causing pressure in the pelvis, causing irritation with the bladder, so urine problems, or even with the bowels and causing constipation. And so from my point of view in general practice, really what I see is that women will come in, and if it's an incidental finding and there's no symptoms, we just monitor things and we have awareness of it. And so the women know that these are things that grow, and if they start having symptoms, they know what could possibly be the cause. And then we have women who have symptoms, and if they're small, less than 3 centimetres is usually my cut-off, I'll try something, whether it's pain relief or contraception, something to help them manage. But if they're bigger than that, really I'm referring, and if their symptoms are really bad, I'm referring to you. And so, for the rest of this video, well, not for the rest of it, but I wanted to refer to you, Dr Stacey, and your expertise in this. Now, I don't know if there's anything that you wanted to add from what I've just, that little summary.
No, I think that was really comprehensive. As you said, they are one of the most common presentations that we see in the gynae clinic. Nearly everyone that comes has fibroids. You've mentioned the risk factors. Ethnicity is definitely one. We really don't know why. I get questions about that all the time actually. Why are black women more likely to get it? We don't know. We think there might be a genetic component. There's also been some possible links with chemicals, which is a few years ago there was a lot of talk about the relaxers that we use in our hair and things like that. But we still don't really understand why they're more common in black women.
Yeah, no, absolutely. And I think from what I saw, even knowing the absolute cause of why people get fibroids in the first place, before we even look at why black women get it more, is still not completely understood either.
No.
So I have the questions here, and what I'm going to do, there were some quite similar questions, so I've grouped them into topics, but on the screen you'll see the different questions pop up from our actual followers. But to start with, the first question was, we've already answered it, why black women are more likely to get them. We don't know the answer, but it's something about awareness. Sometimes having that knowledge helps us to act a bit quicker. Now the next thing, and this was quite a few questions about treatment of fibroids. I alluded to a little bit. I said about pain relief and using contraception for people that need contraception. But questions we had were about diet in fibroids, contraception, are they reversible, can they be permanently removed, was some of the questions we got. So can you give us a bit more of a flavour of treatment for fibroids?
Okay, so fibroids, as you said, 50% of women won't have any symptoms at all. So in women that don't have symptoms, we generally don't recommend treatment because there's no treatment without side effects, as you know. So why take something for something that's not causing any problems in the first place? The symptoms, as you've mentioned, if you are going to have them, is usually heavy, prolonged periods. What else? Pressure symptoms. And if you think about where the uterus is placed between the bladder and the bowel, you can get recurrent UTIs, constipation, pressure symptoms, things like that. So in those cases, we do recommend treatment. As you've mentioned, it is dependent on the fibroid size and how many there are. And 3 centimeters is the cutoff. So if your fibroid is smaller than 3 centimeters, presuming your symptoms at that stage are going to be all about bleeding, then the mainstay of management is really trying to control the bleeding. So some of our viewers may have heard about the Mirena Coil, which is a hormonal coil. That's the gold standard really for treating heavy periods. If you don't like the idea of the coil, then there's other hormonal methods like the pill, cyclical progestogens like injection, and things like that. There's non-hormonal methods as well, like tranexamic acid, which is a medication that works to reduce the amount of bleeding. But those are kind of the mainstays for small fibroids, really.
And that's my realm. And once you go past that...
You can also do surgery as well. You can do hysteroscopy, which is a camera into the test and into the uterus, and do what we call a TCRE or TCRF, which just stands for transcervical resection of the endometrium or fibroid, which what acronym you're using. So that works really well for small fibroids that are within the cavity, because the other thing that impacts what management option you choose is where the fibroids are located, because they can be in the different layers of the uterus. Now, anything that's much bigger than 3 centimeters, you're generally looking at surgical options. There are very specialist medications that we use as well, that work by switching off the ovaries. So we generally don't like to leave you on them for a long time, particularly if you're young, because it will push you into kind of artificial menopause, and then we have to give you more medications on top of that. But they are really useful medications to use prior to surgery, for example, to shrink the fibroid beforehand so that there's less bleeding and less kind of trauma. And then your other surgical options are things like uterine artery embolization, which is when we try and cut off the blood supply to the uterus. That does help the fibroid shrink. And you get a really good effect with that, actually. Up to 90% of women will have no symptoms a year later on. But you just have to be mindful. There's a small risk that when you knock off the blood supply to the uterus, you could also affect the ovaries. If you've not finished your family, that's something to bear in mind. Myomectomy, which as well is removal of individual fibroids. Obviously, if you've got many, we wouldn't recommend that because your uterus will look like a cheese grater.
Yes.
But again, if you haven't finished your family, it's something to be mindful of, because if you do what's called breaching the cavity, then that can have implications for if you get pregnant later on. And then finally, hysterectomy, that's the most final thing. Removal of the uterus, but then obviously you can't have children after that.
So as you can see, there's a lot of options there, isn't there?
Yeah, a lot.
There's a lot, and it can start from very, very simple to these more drastic things, even down to completely removing the uterus. Now, some people asked as well about if they can be removed permanently. So say we do on these things, apart from hysterectomy, because they can't grow back then. But before that, say you do get some reversal or some shrinkage of them, is there a high likelihood of these recurring or increasing?
Not a high likelihood. I think if you went with the UAE option, so that's where you cut off the blood supply to the uterus, your chances of recurrence are, I think, about 15%. A few years later on down the line, those women may need either a repeat procedure or more drastic surgery. But other than that, you generally get really quite good results.
Okay. That's excellent, So if you do, because that's what the worry is, you go in to have a procedure, a surgery, and then you've got to do it again like the next year or something. But 15%, that means 85% of women do get a good result. That's really good. Another question was about diet and weight loss and why it's hard to lose weight having fibroids. I guess first, is there any dietary things that you would suggest for somebody with fibroids?
If you Google, it'll come up with fibroid diet. I'm not recommending.
I've seen it.
You can see it all over Google. However, what does the evidence show? The evidence does show that, I mean, we know, many of you have probably heard recently about the whole food plant-based diet that's been getting a lot of publicity, a lot of celebrities are going vegan, etc. But actually there's a lot of evidence to show that it's really effective in managing, sometimes reversing common chronic conditions. And it's the same with fibroids. The evidence shows that the women that consume more fruit and vegetables, have the higher number of portions per day, actually have a much lower risk of developing fibroids. So whole foods and plant-based diet, that's the way to go, really.
And you'll see that theme on my channel as we talk about different conditions. The diets, people saying there isn't usually a magic food or a magic cure for these things, but this overall whole food and really eating from the earth and things has such a profound effect on our bodies. So we've really got to consider that.
I think we really underestimate it.
Yeah, definitely. I think we get very reliant on medication.
Pills. Just give me a pill, doctor. But actually, what you need, because it's easier than lifestyle change, isn't it? But that's what we really need to be doing.
Because it's easy in the first instance, like it's quick, it's a quick fix. But long-term, being on long-term medications and the countless number of people that complain about symptoms and side effects and everything, sometimes it's actually easier long-term to maybe do the lifestyle changes. And another one was about weight loss. So we had one person that said, why is it so hard to lose weight when you have fibroids? And someone else said, losing weight, does that help to shrink fibroids?
Yes. Okay, I'll tackle the first one first. So why is it so hard to lose weight with fibroids? Depends. I don't think there's necessarily any research showing that you can't lose weight with fibroids. You are able to. As to why you might find it more difficult, I suppose depends on the size of the fibroid. If you've got a big bulky fibroid sat in your abdomen, then no matter how much weight you lose, it's always going to be there, taking up more space than it should. And what was the second one? Will weight loss help? Yes, you mentioned obesity being a risk factor. That's because fibroid growth is driven by estrogen. Fibroids have loads of estrogen receptors, so the higher levels of estrogen, the more they grow. With obesity, the issue is that you have a lot of fat cells, and fat cells are one of the major stores and producers of estrogen. So the more fat you are, the more estrogen you produce. And you probably shouldn't say fat, but the more fat cells you have, the more estrogen you produce and the more estrogen you're storing. So the more you're stimulating that fibroid to grow. So yes, weight loss should help with fibroid size shrinkage.
The next kind of topic is all about fertility, pregnancy, fertility, all the things going with it. And I spoke at the beginning about how it presents. I spoke a lot about heavy bleeding and some of the pressure symptoms, but actually something that I see quite a lot when we find incidental fibroid, but I guess it's not incidental because the symptom would be the infertility or subfertility. But this whole thing of somebody struggling to get pregnant, and so we'll do some baseline bloods, an ultrasound scan, and we may find some fibroids. in terms of fertility, the questions is first of all, how does it impact it? Was the first question.
Okay, so the first thing I'd say is that fibroids don't stop you getting pregnant. You can still get pregnant. Or I should say the majority of women will still be able to get pregnant with fibroids. Because you mentioned incidental scans. Often a lot of women will only find out they've got fibroids because they've gone for their dating scan and there's like, oh, there's baby and there's also a big fibroid here. So do fibroids affect fertility? They can, depends on their size and location. So if they're located near to the opening of the fallopian tube into the uterus and they're blocking it, then yes, obviously you're preventing the sperm from meeting the eggs and you're preventing conception. We also know that women with multiple fibroids have a higher risk of miscarriage, so they can impact your fertility that way. But as I said, the majority of women will usually still manage to get pregnant, and then it can have implications in pregnancy, but at least they're pregnant.
You've answered the questions about can they cause miscarriage, and depending on their size and location, it can do that. But another question was also about preterm labour, and you kind of just alluded to some of the effects it can have in pregnancy. I'd love to know a bit more about it, because from what I see in pregnancy, of the few people they actually get to deal with while they're pregnant with their fibroids, I've had some people complain of pain, because I think in pregnancy they can shrink and sometimes that can cause pain, is that right? Or?
Yeah, so if fibroids are going to grow, they're usually going to grow during the first trimester, but then after that they tend to shrink. But what can happen in pregnancy is you can get fibroid degeneration, which is where they start to break down, and that can cause a lot of pain. So that's one of the things that we commonly see. Well, not commonly, but it happens. As for preterm labour, yes, that can also happen. And if you think about it, it's because the fibroid is causing extra stretch on the uterus. And we don't fully understand how labour starts, but we know that that's part of it, that the degree of stretch on the uterus is like, oh, I need to go empty now. So yeah, that can definitely happen. Other issues with fibroids in pregnancy are, if we talked about location being important, so if the fibroid's right down at the bottom, is it blocking baby's way out, in which case we may need to think about doing cesarean. Also, because again it depends on where the fibroid is and the size, but it can make the uterus contracting down after delivery quite difficult, and so then that increases your risk of having a big bleed after as postpartum hemorrhage.
Okay, brilliant.
Lots of
information. Guys, you see why I got around the channel. Now, that was really the majority of the questions. I hope that we've answered everybody. And if you do have any more questions, please leave them down below. The last one that we did get though was slightly unrelated to all the other things we spoke about. And somebody wanted to know, is it related to thyroid issues, fibroids?
Yeah, so I actually had to look this up.
Yes.
I haven't heard about it before. But yeah, there are some studies that have shown that, I think they were done in China, that women that have fibroids were also more likely to have thyroid nodules, which are small swellings on the thyroid gland. Now the study, interestingly, didn't really mention whether or not there was any hormonal imbalance there. So no, your fibroids aren't going to make you hyper or hypothyroid. In fact, they only found that one of the thyroid hormone levels was slightly low, but I believe it was still within normal range. Again, they don't know the connection. They think it may all be hormonally driven, because they know, as I said, estrogen drives the fibroid growth, and it's also associated with ovarian cancers, endometrial cancer, which are also hormonally driven, and thyroid as well. So I know they're doing some further research to see whether or not it's related to thyroid cancer, but that's kind of all we know at the moment.
Yeah, and so I thought that was an interesting question, because when I saw that, my first thought was no, I don't think it. I don't see people with thyroids.
Does it enter the body?
Yeah, I was like, no, I don't think they are related to different kind of hormones. I thought maybe some thyroid conditions might make bleeding worse, is what I thought, but that's interesting, so thanks for sharing that. But I hope you all enjoyed. Now, like I said, any questions, leave them down below. We are going to be doing the second part where we're talking about endometriosis, so please come back next week to find out some more. And don't forget to make sure you follow Dr Stacey, Caramel_Dr7 on Instagram. I'm like Dr Amanda. Please subscribe, like and share this. We've got lots more information coming for you on these Medicine Mondays. And thank you for joining me today.
Thank you for having me.
See you. Bye.